having control over my care. I don't think that actually happened until I was probably about 14 or 15. My parents gave me a good understanding of basically how to have and maintain that control, and that actually made me become more aware of how to see that my care was being delivered properly in the adult side, because you know your health inside out. So I built a rapport with my physician, who I've now been under for the best part of 11 or 12 years. He's a great physician, and much of the care that he has provided has been based on good relationships with the pediatric team, and obviously making sure that every stage of my care is delivered almost on a very personal level, and that's what this is all about, really. Our hospital provides shared decision making. They have new patient open days where professionals from the department would come as well and provide them insight into what each form of treatment will entail, and then that would then allow patients to actually make more informed decision based on their current lifestyle. I wanted to keep my care separate almost from my home life or my work life, so I decided that hemodialysis treatment at the hospital was best for me, because the way I had seen it from a young age is that because a lot of my kind of schooling and learning and understanding was very much interrupted, I decided against having it at home. But I also felt that if I did it at home, that I probably would almost feel like I'm burdening someone here in my family. Where I had to make important decisions, what I felt was a variety of emotions, really. At first I was a little bit nervous, trying to understand how it would fit into my daily routine or my lifestyle. There were times where I was scared, and I was tempted to leave dialysis on some days. I think what made me overcome all of these emotions and feelings was basically talking to people who had kidney disease themselves. And although I've had the disease for 30 plus years now, you still have anxieties and reservations about certain parts of your care. But I think it was the best decision for me to have it in the hospital, because again, it was basically that I wanted to separate things, and at the same time it allowed me to become aware of other important parts of my care that I needed to be a bit more strict on. For example, aspects relating to diet and also my medical regime. I was able to ask the nurses, and I always thought that I should learn from the form of treatment I was on, and learn from the people around me and their circumstances. And so I was literally sharing and understanding as I went along, and I think that's literally helped me cope. But the fact is that it's having a positive mindset which actually helps you deal with your situation on a daily basis. And I think that's when I was surprised to receive a transplant. It's not like it was a shock to my body. In terms of when I had the actual operation, I recovered very quickly. So literally, I think being positive makes a massive difference. Based on my own experiences and in shared decision making, I think the most important insight I could probably pass on to maybe clinicians as well as patients is that there has to be a process whereby everyone is involved, and making sure that the decisions are being made based on information that is current and that is evidence-based, and a package is delivered to patients based on their lifestyle and what would suit them. And what's benefited me is actually speaking to others about it and learning from them and their experiences, because the idea of shared decision making is such that you have as much information around you from various sources, and that means you really need to be able to perhaps find others who are in similar circumstances to get their insight, and I think that's very much helped me along the way as well.